Hello. On the 15th of March, Inovio presented at Oppenheimer's 32nd Annual Healthcare Conference. CEO Dr. Joseph Kim had a fireside chat with, and I'm about to butcher his name, Singh of Oppenheimer, to talk about everything Inovio going forwards.
In fact, we have 4 separate phase 3 trials going. Now, this won't happen overnight. Our inventories are very strong.
There were some big Easter eggs released that I believe signals big things to come in 2022. So stay tuned for all the highlights, a quick drill and more. Keep it simple. Now, before we drill into the conference call, know this. The short interest on float just keeps going up. It is now at 23.25%. This is just absolutely sickening, absolutely disgusting. If you look at the short volume off exchange, i.e. the dark pools, we are at 45% yesterday, 46 the day before, and up to 51 and 57 last week. But more importantly, I want to look at this. Now this to me doesn't make any sense. If you look at the reported fails to deliver dating back to the 28th of February and the 25th, 24th, 23rd and the 22nd, we had 5 consecutive days of over 10,000 undelivered shares. Meaning what? Meaning that Inovio should have been placed on this, the threshold securities list, which are securities that have an aggregate failed to deliver position for 5 consecutive settlement days at a registered clearing agency, totaling 10,000 shares or more, and equal to at least 0.5% of the issuer's total shares outstanding. Well, something doesn't smell right to me. And when you go to the threshold securities list, where the hell is Inovio? It's not there. It's nowhere to be seen. And I'll leave that for you to chew on.
Inovio, as you know, is a DNA medicines company.
You don't frickin' say. Can we just get on with it?
In fact, we have 4 separate phase 3 trials going for our lead products, INO 4800 and VGX 3100, 2 phase 3s each. And we have a strong financial and human resources to execute what amounts to be a very important year in 2022.
Okay, and why is that? Could it be the expansion of your pipeline?
Obviously, we have an Innovate phase 3 trial for INO 4800. Our collaborator, WHO, is also conducting a solidarity vaccine trial. Our INO 4800 is only DNA vaccine that was chosen to be part of this global phase 3 trial. Of course, I'm sure we'll talk about more.
I can see the WHO releasing some form of update or even data readout within this year, and that could be absolutely ginormous for Inovio.
We're currently finishing a phase 1/2 trial for our orphan drug indication against recurrent respiratory papillomatosis in INO 3107. We received the orphan designation in 2020. We look forward to having the data in 22 from this phase 1/2 trial, safety, immunogenicity, and efficacy. And we're looking to push that into a phase 3 trial before the year end this year. So I think 2022 will be a very eventful year for Inovio.
Absolutely disgusting. If the phase 1 results of INO 3107 are positive, then oh my, another phase 3 will be initiated this year. And what about the timeline for INO 4800? Come on, Dr. Kim. Throw me a bone here.
In terms of the timeline, as we stated in the call, this will delay our data point from around the mid-year to probably by the end of the year. But we haven't given a firm projection of the timeline. We think it's going to depend on the time it takes to amend and getting the approvals through the regulators. And, it's not trivial, but it's something that we are very confident that we can execute.
Well, there you have it. The readout should be forthcoming by the end of this year. But in all honesty, could this be the first time that Inovio has underpromised and will deliver results quicker? There is a strong possibility, if you're asking me, that these other countries are going to move very fast to approve of the amended endpoint. Why? Because Omicron and more variants of concern are seemingly sprouting up everywhere, and the COVID-19 infection rates seem to be getting worse. So, this is no time for the countries that are participating in the Innovate trials to slow down.
The Pfizer CEO made some news earlier this week saying that the fourth dose of booster will be needed against the current variant. And, it could be, as you said, sixth, seventh, or nth time you may need to be boosted to jump charge your immune system against the circulating strain of the COVID virus. DNA vaccines like INO 4800 will come to play an important role in this ever boosting environment of COVID pandemic and subsequently endemic. Our vaccines have been shown to be able to be re-administered without any anti-vector responses. We have a very favorable tolerability and safety profile between all the trials that we've done for 4800, but for our other vaccines in our pipeline as well. The T cell responses can be boosted. So again, the paradigm of trying to protect us from getting severe disease or severe symptoms where T cells play this critical role. I do believe that our DNA vaccine, INO 4800, will excel in this regard.
We already know the safety and efficacy and tolerability of INO 4800 from the phase 1 readout, and it's just mind-bending that this DNA vaccine is still being held back. We need safe vaccines to be deployed for humankind worldwide.
What we have seen with INO 3107 and its predecessor program, by using the patient's own immune system, particularly the CD8 T cells, CD8 T cells, CD8 T cells, it's the same CD8 T cells that we're talking about with our other more advanced programs. You can target these CD8 T cells to seek out and kill those small tumors. So we have seen that in our early phase 1 pilot trials. And we currently have a 32 patient phase 1/2 trial that was fully enrolled in the fourth quarter, and we should have some data later this year.
Now, did you get that? INO 3107 data to be released by the end of this year. That could be very big indeed. And that's because INO 3107 targets orphan disease, and they received their orphan designation for 3107 in 2020 from the FDA, so they should be able to move very rapidly into phase 3 pivotal trials by the end of this year. Now, listen very carefully to the updates for VGX 3100. This is critical.
And Hartaj, I couldn't be any more excited about VGX 3100 because this will be one of the most important medical advancements in women's health in many decades. Our ability of 3100 to give women the choice of avoiding surgery, but still be able to treat the disease of cervical HSIL. But not only that, being able to clear the virus that caused the disease in the first place, I think is a powerful choice and powerful option for women to have who are looking at this precancer. If left untreated, could turn into a full-blown cervical cancer. So it's been many years in development, and we're really excited about completing the second confirmatory Reveal 2 trial this year, being able to present more on our biomarker advancement later this year as well.
And listen to this next segment from Singh, who nails it right on the head as to why we Innovians know that Inovio will inevitably rise up from the ashes, and we know why our stock has been pummeled so badly.
Also, it's always puzzling to me sometimes the pushback I get on Inovio, and yet, you've got WHO as a partner in a large phase 3 trial. You've got QIAGEN, one of the best companies out there as a partner in biomarker-driven strategy. You've got Thermo Fisher, one of the best manufacturers out there, helping you manufacture. You've got Regeneron, one of the best biotech companies out there with your GBM vaccine. So I was kind of scratching my head. Of course, I scratch my turban, not really my head, which is why all this, snark on Inovio. But anyways, that's a different conversation.
For me, the biggest Easter egg is this coming segment right here in the Q&A, where Dr. Kim was asked about his Cellectra.
We have Cellectra 2000 that we're using for our clinical trials. So we have extensive inventory to execute all of our trials, including COVID-19. We have Cellectra 5PSP that's currently being used in Review 1 and Review 2. We have also used them in some of our vulvar trial as well for phase 2. And we have plenty of inventory. We're actually gearing up the commercial inventory, starting that as we prepare to wrap up Reveal 2 and potentially have the package in preparation for our future commercialization. And of course, we're gearing up our Cellectra 3PSP, both for regulatory approvals, but also for our potential emergency use. Once our Innovate and Solidarity trials, once we can demonstrate efficacy and safety, of course, our end game is to apply for emergency approval and then the full approval. So, we have been solving the scaling up of device manufacturing. It's one of those platform things. It does slow us down of our clinical device from going from phase 1, phase 2 to phase 3 for COVID vaccine. But we have solved for these issues, and the beauty of these platform is that once you solve for them, you don't have to deal with the same issues again. So our inventories are very strong. And then, as we develop out the COVID-19 platform, once we get our first product approved, we would be able to utilize the bridging strategy that many of the regulators have been deploying to bridge into the new variant as necessary. But our current focus really is in getting 4800 tested and approved through emergency and full approval where appropriate.
To summarize, this was a very strong fireside chat where Dr. Kim basically laid it all on the line. For 2022, we essentially have 4 phase 3 trials with a potential 5th to be initiated in Q4. We have the only DNA COVID vaccine selected by the WHO, the World Health Organization, for the Solidarity vaccine trials. We are undergoing booster trials in China via Advaccine in partnership with Sinovac. We will also expect, as Dr. Kim confirms, Reveal 2 data for VGX3100 by Q4, which would then mean commercialization, and in his words, this will be one of the most important medical advancements in women's health in many decades. And finally, with the huge Easter egg confirmation that Cellectra device inventories are very strong, it means they are already gearing up for mass production and commercialization. Things are looking phenomenal when you realize this stock is trading around $3. Does it make any sense to you? Leave me a comment as to where you think Inovio will go this year. Thanks for watching, and please do take this drill with precaution and always do your own DD. If you found this video informative, then do me a simple favor and consider subscribing to this channel so you get a pop-up when a new video is uploaded. I am a simple trader. I try to keep this simple, and will simply see you in the next one.